Committee on the Climate Crisis Act 2020. Recognize the member for Toronto Danforth.
Thank you, Speaker. Speaker, we need to take action on the climate crisis, and we need to take it now. I'm very pleased to bring forward this bill, the No Time to Waste Act for Climate Action and Jobs, with my co-sponsor, the member for Parkdale High Park, Ms. Carpachet. We'll be splitting the time for this opening statement. Speaker, people want a future for themselves, they want a future for their children and their grandchildren. And they know that that future depends on action being taken now to take on that climate crisis. People know how serious the climate crisis is, and they want governments to lead. Ontarians want their governments to protect them from the climate crisis by mobilizing resources as well as developing plans that all parties and sectors of society can buy into, and this bill does just that. The experience with COVID has shown how vulnerable our society is to disruption, and we can't afford to repeat that lack of preparation with the climate crisis. Speaker, we don't have to continue the deny and delay program that this government is engaged in. The Premier dismantled Ontario's cap-and-trade program, which was funding climate-protecting energy conservation retrofits in schools and hospitals. He ripped electric vehicle charging stations out of the ground. He had a wind farm demolished that would have provided emission-free electricity, and he would have demolished a second one but lost in court. Last week, the report of the Environmental Commissioner revealed that this government has wasted 2 years of its mandate when it comes to the climate crisis. It does not have a coherent plan, and it's not even acting on the weak plan that it has in place. It could have changed the building code, the regulations that builders have to respect when they put up new buildings, which would have substantially cut emissions at no cost to this government, but it didn't do that. It could have directed the gas utilities to accelerate energy efficiency programs that would cut emissions and keep people's gas bills, but it hasn't done that. Railing against the federal government and presenting plans that you ignore is not a way to take on a crisis. And as we've seen from the COVID-19 pandemic, preparing and planning in advance of a health crisis, listening to experts in science and in health are essential components of an effective response. This government has failed in both respects, and this bill would take steps to prevent a similar failure in the face of the climate crisis. Speaker, we can do this. Ontario before has risen to the challenge. At the beginning of the 20th century, we set up an electricity system based on renewable hydropower, and we set the foundations for an advanced industrial society. During both World Wars, Ontario ramped up its industrial infrastructure so that we could provide the equipment and the ammunition necessary to win both those wars. We've built an economy that can provide a decent standard of living for the majority of people in this province, and frankly, Speaker, we can take the next step to provide a decent standard of living for all. The bill has 3 parts, and my colleague will talk to the need to prepare our healthcare system for the challenges to come. I'll speak to the 2 parts that could allow us to move forward now. Speaker, the government has effectively abandoned this issue with its so-called plan. It's time we convened a select committee of legislators to hammer out a plan that all parties in this legislature can live with. We can have all 3 parties represented in a select committee to bring forward a plan that can mobilize Ontario. The government is always asking for ideas. Well, now's the opportunity to bring everyone in this legislature together to develop a plan of response to actually protect us and make sure that we do have a future here in Ontario. And at the same time, we can address the particular threats facing Indigenous, racialized and low-income Ontarians. While we're doing that, Speaker, we need to use the powers that are already at our disposal. We can use the public sector to accelerate the response to the climate crisis and make that transition to a net zero future. The retrofit of the buildings we use or own, the revamp of practices and equipment, the use of purchasing power to accelerate the adoption of low and no carbon products will allow us to ramp up our efforts and meet our targets. Developing and putting in practice a climate crisis strategy for the public sector will encourage action on the climate crisis through the society as a whole. We can encourage, through purchasing and specification, the development of innovative technologies. We can put tens of thousands of people to work. And, Speaker, within that, we can set short-term, immediate goals, capping emissions for the broader public sector within the year that this plan is adopted. And, Speaker, after that, reducing emissions by 5% a year until we reach zero. We can engage in large-scale retrofit of public sector buildings immediately, and we can set net zero targets for new buildings built within 5 years. That, Speaker, would cut the cost of energy in this province for the public sector by over $100 million a year. It would allow us to put tens of thousands of people to work. We have an unemployment problem because of COVID. We can address that. We have a climate crisis coming at us. We can get ready for it. And with that, I turn the floor to my colleague, Ms. Carpenter.
The member for Parkdale High Park.
Thank you, Speaker. I'm honoured to rise on behalf of the people of Parkdale High Park to speak to this bill titled No Time to Waste Act, a plan for climate action and jobs. I will be focusing my remarks on Schedule 1 of the bill, the Climate Crisis Health Action Plan, and throughout I will be reflecting on what we've learned from the COVID-19 pandemic so far that makes this bill important. Speaker, we've spent the last 9 months dealing with the health crisis that has resulted in over 100,000 confirmed cases of COVID-19 and more than 3,000 deaths so far. It has caused a deep economic crisis as well. The virus and all that has resulted from it has revealed and exacerbated social, economic, racial, and gender inequalities and worsened our collective mental health. It has required us all to fundamentally change the way we live, work, study, and play. While many hope that this pandemic will be the last crisis in a very long time, a significant increase in contagious diseases like COVID-19 is just one of many health threats that the climate crisis poses. According to the World Health Organization, the Canadian Medical Association, the Canadian Public Health Association, and many health professional groups, I quote, "Climate change is the greatest global health threat of the 21st century," end quote. The climate crisis will cause more disease, extreme heat incidents, danger caused by forest fires, flooding, severe storms, degradation of air and water quality. This will also lead to direct harms of health, but will also impact the core social determinants of health, including housing, food security, social supports, and reliable, adequate income. The climate crisis will also cause more poverty and a lowered standard of living. We must also be aware of the devastating impact the climate crisis will have on our mental health. Adverse experiences due to extreme weather events, forced migration, and grief over the degradation of the planet, and an uncertain future will inevitably lead to increased anxiety, depression, and other mental health disorders. We have seen how a crisis like COVID-19 has caused a sharp rise in Ontarians reporting poor mental health, a demand that is not being met by the government. We must ensure that our mental health services are prepared to deal with the increased need that the climate crisis will cause. Speaker, we have seen during this pandemic the largest burden will fall on the collective mental and physical health of those who belong to communities already made vulnerable. This includes Black, racialized Indigenous people who are forced to contend with the harms of structural racism. It also includes those who face food, income, and housing insecurity, older adults, and members of the disabled community. All the people pushed to the margins of our society will suffer disproportionate harms to their health. We have seen an inequitable distribution of health impacts during this pandemic, and we must not allow it to happen again. Speaker, there is consensus among climate scientists that the effects will be devastating and that it has already begun to significantly impact life on our planet. With the overwhelming evidence we have, there is no excuse to not be prepared. We must begin to put in place the structures and procedures necessary to address the health impacts of the climate crisis. This bill would require the Minister of Health to develop a strategic action plan to ensure Ontario's public health and healthcare systems are prepared to handle the health impacts of the climate crisis. The bill would also establish a climate crisis and health secretariat composed of leading experts in health and climate to help develop this plan. Ontario's public health and healthcare have been overwhelmed by COVID-19, and we cannot let that happen again. This bill would also establish a science advisory board to advise the minister with respect to climate change science and health sciences and the impact of the climate crisis on public health. One of the key lessons of COVID-19 has been that we rely on the advice of scientists and health experts to guide us through crises. Speaker, the urgency of the climate crisis demands action, and crucially, dramatically reducing our carbon footprint. Unfortunately, the Ford government's record on climate change and the environment speaks for itself, and Ontarians deserve better. But given the degree of certainty that we will experience negative health impacts from the climate in the future, we must also take concrete steps to ensure the health of present and future generations. In light of COVID-19 pandemic, I hope that my colleagues in the legislature will reflect on the urgent necessity to prepare for the health crises, and I strongly encourage everyone to support this bill. As Greta Thunberg said, quote, "Our house is on fire." Speaker, young people across Ontario and Canada and the world are urging leaders to act on the climate crisis. We do not have the luxury of time. As the title of the bill states, we have no time to waste. We must move ahead with this climate action and jobs plan. Thank you.
For the debate, the member for Davenport.
Thank you, Madam Speaker, and thank you to my colleagues for putting forward this urgently needed motion. Madam Speaker, it's always a privilege and an honour to rise on behalf of the constituents of Davenport, and the people of Davenport understand that the climate crisis is already changing our lives, impacting our safety, our homes, and that it will only get worse without action. In neighbourhoods like Silverthorne, flooding is a constant reminder of this. 2 weeks ago, I convened a town hall on environment and climate change in Davenport to hear from experts and advocates and to talk about a vision for a stronger, more sustainable economy. Sadly, this government's actions have dragged Ontario backwards in the fight against climate change, dismantling Ontario's cap-and-trade system, opposing carbon pricing, and abolishing the Office of the Environmental Commissioner of Ontario. The list goes on and on. Madam Speaker, my father, Dr. Jeffrey Stiles, is an energy conservation and climate change expert. I grew up with this. And I remember so many years ago him working, 40 years ago, on programs to encourage the retrofitting of buildings. Our Green New Democratic deal recognizes this. It recognizes that retrofitting buildings is the most cost-effective way to reduce emissions while creating significant economic benefits. In Canada, research shows that investing in energy conservation measures creates $4 in economic activity for every $1 invested. For Ontario, that could mean an additional $15.2 billion per year added to our GDP between 2022 and 2030, creating at least 60,000 new, good, green jobs. Using our authority in the broader public sector to drive these large-scale retrofits would put people to work quickly and generate the practices and technologies to accelerate energy retrofits in the rest of the economy. That's why I'm so very, very proud that in the absence of leadership on this challenge facing humanity, New Democrats are leading the way. This motion sets out the structures we need to respond to the climate crisis and the health crisis that accompanies it. It would position the province as a leader in this fight, mobilizing the public sector to protect people and accelerate the transition to a net zero future. As we've seen from COVID-19, Madam Speaker, planning in advance of a health crisis, listening to experts in health and science are essential components of an effective response. This government has failed in both of those respects. I am so grateful to my constituents who have been active in demanding a better future for our province and our world, and I am grateful to all the youth, my own daughters included, who have been demanding urgent emergency response to climate change. This bill would take us steps forward to prevent similar failures to what we've seen with COVID-19. I urge all members to support us in this generational effort against climate change. Thank you, Madam Speaker.
For the debate, the member for Mississauga East Cooksville.
Thank you, Speaker. Today, Speaker, I stand to speak to Bill 224. This bill is lengthy by private members' bill standards, and as I want to respect the limited time I have to debate it, I will focus my comments today on the proposed Schedule 1. Speaker, today I will be recommending against supporting this bill because most aspects are already in place and covered by existing public health legislation, standards, and/or the government's Made in Ontario Environment Plan. Aspects are also covered through the ongoing mandate of Public Health Ontario. In particular, I will note that the Ontario Public Health Standards requirements for programs, services, and accountability published by the Minister of Health provides the public health standards for the provisions of mandatory health programs and services, according to Section 7 of the Health Protection and Promotion Act, HPPA. The standards identify the minimum expectations for public health programs and services. The foundational standards of public health assessment and health equity can be applied to determine and mitigate negative health effects of climate change, including those on vulnerable populations and at increased risk of poor health outcomes. The Healthy Environments Standard directly applies to environmental health prevention and response activities to address the health effects of climate change on the population. Speaker, the Healthy Environment and Climate Change Guidelines also provides direction on how to approach specific requirements identified in these standards. The Ministry of Health has developed the Ontario Climate Change and Health Toolkit to assist public health units in conducting health vulnerability assessments, develop adoption plans, and raise public awareness about the health hazards and health impacts of climate change across Ontario and for local populations. As a result, most of Bill 224's proposed contents and monitoring requirements are already being implemented by public health units as part of their requirements and responsibilities for delivering programs and services aimed at preventing the spread of disease and promoting and protecting the health of the people of Ontario under the standards published by the Minister of Health under the Health Protection and Promotion Act. Speaker, I appreciate the opportunity to raise these points today, and I trust my colleagues will address other portions of the bill. Thank you.
Further debate? I recognize the member for University Rosedale.
Thank you, Speaker. I'm proud to stand here on behalf of the residents of University Rosedale to show my support for the No Time to Waste Act, a bill introduced by the MPP for Parkdale High Park and the MPP for Danforth. Climate change is the biggest global health threat of the 21st century, the biggest, from biblical floods that have hit Houston and Puerto Rico, from killer heat waves that are affecting so many parts of the world, from the fires that are devastating towns like Fort McMurray to whole states, like what has happened this summer with Oregon and Washington and California, to the increase in vector-borne diseases like Lyme disease, to the massive increase in anxiety and depression brought about by people's very real fear for the future. Climate change is fast becoming a health crisis and an economic crisis which will far exceed the devastating impacts that we are experiencing right now with COVID-19. A pandemic that has already killed over 3,000 people and has forced our economy into an economic recession. That is why I support this bill today, the No Time to Waste Act, because this bill calls on the Ontario government, the Ford government, to prepare our public health system and our healthcare system to cater and to be ready for the climate crisis that is fast coming, because we cannot afford to not be prepared. If there is one thing that this pandemic has taught us, is that there is no time to waste, and we need to be ready for when this inevitable crisis will hit. Now, I know this government is no friend to the environment. This government has closed wind farms, you've gutted the cap and trade process, You have gutted the environmental assessment process. This government is letting developers build where they please. Doesn't matter if it's wetlands, doesn't matter how it will impact our transportation system moving forward. And the latest Auditor General report shows that this government is treating its own environmental plan, its own climate change plan, with disdain. You're not even meeting your own very poor targets. I get it that this would be a shift for you, but I also know that voters in every riding, including your ridings, care about the environment too. They care about the environment, they care about their kids' future. The youth in your ridings care about their future as well. And everyone wants our healthcare system to be there for us, doesn't matter what crisis we face, because that is what Canada is all about. That is the morally right thing to do. That is why I am asking you to vote for this bill in support for the No Time to Waste Act, because we literally have no time to waste. Thank you.
Further debate? The member for Aurora Oak Ridges, Richmond Hill.
Thank you very much, Speaker. Speaker, I rise today to speak in opposition to Bill 224, particularly the flawed Section 2. The schedule enacts the Ontario Climate Crisis Strategy for the Public Sector Act 2020, which is simply unreasonable, unworkable, and unrealistic. Section 2 of Bill 224 requires the capping within 12 months after the strategy takes effect, emissions of greenhouse gases from activities engaged in by the public sector. First, let's take a look at how the proposed act defines public sector. The definition of the public sector in the proposed act cross-references the Public Sector Salary Disclosure Act 1996, the PSSDA, and would cover a broad class of entities including the Crown and Crown agencies, municipalities, various local boards, including school boards and boards of health, hospitals, colleges, universities, Hydro One, Ontario Power Generation, and provincial grant recipients that meet the provincial funding threshold in the PSSDA. This is a prime example, Speaker, of how the NDP thinks bigger government can solve everything without actually thinking about the impacts. Relying on the definition of public sector within the PSSD would impose new red tape and regulatory requirements on organizations with limited administrative capabilities. The PSSDA covers a wide swath of Ontario's public sector, including non-profit organizations that receive significant government funding, YMCAs, YWCAs, health clinics, victim services centres, women's centres, homeless shelters. Indigenous organizations are just a few examples of organizations that the PSSDA applies to, and this proposed bill would also impose this burden upon. Last year, the PSSDA covered more than 1,700 different employers. This would mean, for instance, that in MPP Carpocha's riding, the Parkdale Queen West Community Health Centre, which was on the Sunshine List in 2019, would be impacted by this bill. Instead of focusing on providing health services, the clinic administration would instead be asked how they could reduce their greenhouse gas emissions to net zero. To get a sense of how broad this proposal is, Speaker, one needs to only refer to whom the Public Sector Salary Disclosure Act covers. The Act covers the Government of Ontario, Crown agencies, municipalities, hospitals, broad public health, school boards, universities, colleges, Hydro One, Ontario Power Generation, and other public sector employers who receive a significant level of funding from the province. Speaker, some of the non-profit organizations are required to disclose if they received significant funding from the Government of Ontario in that year. Generally, funding means transfer payments. It does not mean payments to goods and services used by the government or loans that it will be repaid. Speaker, the province does not have direct operational control over most of these entities. While the province does have control levers in respect to many subsectors of the public sector, as defined in the proposed act, those levers are diffuse and incomplete, and the proposed act itself does not provide centralized power that would permit the provincial government to ensure that the objectives in any plan made pursuant to the strategy would be achieved. Similarly, the proposed act does not provide any centralized information collecting authorities, and it would be difficult to compel the production of information necessary to satisfy the reporting requirements in the proposed Act and to carry out any auditing of such reporting required by the regulations. In summary, Speaker, Schedule 2 of Bill 224 is simply unreasonable, unworkable, and unrealistic, and I recommend we vote against it. Thank you very much, Speaker.
Further debate? Member for Nickel Belt.
Thank you, Speaker. And before I go into the remarks that I had prepared, I wanted to answer a little bit to the comments that were just made about the Parkdale Queen West Community Health Centre in the riding of my colleague from Parkdale High Park. I want the member to know that as a community health centre, every single community health centre in our province are already working on climate change, are already working on how to decrease to net zero because they are part of healthcare. They know, just like the Canadian Medical Association, the Canadian Public Health Association, or the Lancet Medical Journal, that climate change is the biggest global health threat of the 21st century. We are in the middle of a pandemic, but this threat is even bigger, and every community health centre know this. You know what else those community health centres know? They know that the climate crisis will be exacerbated for existing social and economic inequality, meaning that those that are already marginalized in our society, including Black, Indigenous, people of color, will be the one that will be most adversely impacted by the climate crisis. So I want to reassure the member he does not have to worry about this bill effect on Parkdale Queens West Community Health Centre. They are in support. They are already working in that direction, and they would welcome the government support of this bill because they know full well that the people that they serve will be impacted. Community health centre, no matter where they are, serve underserved population, which often means the people that will be most impacted by what's coming. I also want to give a shout out to Sophia Mathur. Sophia is a 13-year-old girl in my riding. She was one of the first students in Canada to take part in Fridays for the Future, the Fridays protest, inspired by Swedish climate activist Greta Thunberg. And I want to let you know that on October, I try to participate with them on as many Fridays as I can. But on Friday, October 30th, myself and the member from Sudbury, we helped then mark the second anniversary of the Friday for the Future with a Halloween themes. So if you're ever in need of a good laugh, go have a look on social media of the pictures of what the MPP from Nickel Belt and MPP for Sudbury looks like as defender of the environment on Halloween Day. But the youth are protesting against the government inaction on climate change. Action on climate change is not red tape. It is really a question of responding to the biggest crisis that our healthcare system has ever seen. You ask anybody who works in healthcare, whether they work in primary care, whether they work in public health, in our hospital, in mental health, we all know, they all know that what is coming will have a dramatic impact on what they do, how they do it, and their abilities to continue to provide the services that Ontarians need. That is why the bill is called No Time to Waste Act. There is no time to waste. We have an obligation to act right now if we want to prepare. We are sort of in a situation right now where we look at the pandemic and nobody can change the past, but we can influence the future. I'm sure that all of us are thinking back of the month of March and the month of April and the month of May, where we were stuck in our house, where we couldn't go out, and we thought, I wonder if we could have planned better for this pandemic. I wonder if we could have been more ready to take action so that the transition through the first wave, second wave of the pandemic would not have such a drastic impact on our lives. We have an opportunity right now to create the right sets of scientific minds within the public sector that will put in place whatever we can to protect ourselves. And I think only good thing comes from getting ready when you know that the crisis is coming. Don't wait till the crisis is here. Don't wait till flooding has started, till our forests are on fire, till disaster has struck to start acting. Every scientific mind will tell you that the climate crisis is coming. Get our healthcare sector ready. This is what this bill is asking for, and I can guarantee you that every actor in our healthcare system is on board. Thank you, Speaker.
Further debate? The member for Guelph.
To rise to debate Bill 224, and I want to thank the members from Parkdale High Park and from Toronto Danforth for bringing this important bill forward. While we know that our priority must be focused on the COVID crisis, we have another crisis, the climate crisis, bearing down on us like a runaway freight train, and there is no time to waste to address this crisis. In the same way that we can't wish COVID away, we can't wish the climate crisis away. The window is closing on our ability to avoid catastrophic, irreversible climate change, which is why we must transform our economies, our communities, and our energy systems rapidly to reduce climate pollution. In the same way, Speaker, that we must listen to the scientists and the experts in dealing with COVID, we also have to listen to the scientists and experts in dealing with the climate crisis. And that is why it is so vital to prepare our healthcare system for the health risk caused by the climate crisis. COVID-19 is showing us what a planetary health crisis feels like. Unfortunately, not only does a changing climate mean we're going to likely have more pandemics, but it's also going to increase the risk of asthma from forest fires, the risk of traumatic evacuations, deaths from heat waves, hunger from crop failures, and so many other public health risks. That is why the World Health Organization and many other health organizations calls climate change the biggest public health threat of the 21st century. And you know, last week's Auditor General's report showed us how we were not ready for COVID-19. In the previous week's Auditor General's report showed us that we're not ready for the climate crisis. And so the time to act is now. We can't repeat the mistakes of not being adequately prepared ever again. And that is why our healthcare system must be ready. In regards to Schedule 2, I must disagree with the member opposite. I can't tell you how many people have come to committee, especially businesses, saying that government procurement provides an opportunity to help us emerge economically from the economic crisis caused by COVID, but can also help prepare our public sector to reduce energy costs, becoming more energy efficient, and reducing the operating costs of public sector entities. And I want to close, Speaker, by saying that having an all-party select committee to address a climate crisis makes so much sense, because one of the things is we know that climate action is job action. And as we talk about emerging from COVID, we need an all-party committee to talk about how we can do it at the same time we address the climate crisis. Thank you, Speaker.
Further debate? The member for Barrie-Innisfil.
Thank you, Speaker. And I stand to talk about the Prime Member's Bill introduced by the member Toronto Danforth, No Time to Waste. And it's interesting he says there's no time to waste because on November 29, 2018,
our government released our Made in Ontario Environment Plan. The member introduced his private member's bill on October 27, 2020. The member waited 698 days, or 1 year and 10 months and 28 days after our government already introduced or Made in Ontario Environment Plan that already echoes the actions that are in his private member's bill. Bill 224 proposes monitoring requirements already being implemented by public health units as part of their requirement and responsibilities under the, wait for it, Ms. Speaker, under the standards published by the Minister of Health under the Health Protections Promotions Act. Furthermore, Bill 228 proposes for scientific advice and expertise. Been there, done that. Our government currently has an advisory panel on climate change consisting of experts on climate change resiliency, as well as people from other sectors like agriculture and insurance. Bill 224 proposes for a climate crisis and health secretariat, but currently Public Health Ontario already plays a major role in providing scientific and technical advice, as well as they help focus on vulnerable populations that are at greater risk of exposure due to climate change. As a result of our efforts here in Ontario, greenhouse gas emissions have decreased significantly since 2005. And in fact, Ontario has shouldered the largest share of Canada's progress to the 2030 provincial agreement targets. Since introducing our plan 2 years ago, not a few months ago, we have been elected to create change, and we acted on climate change swiftly when we first got elected. In our Made in Ontario Environment Plan, we already implemented the first ever climate change impact assessment. We created an emission standards program, which has been recognized by the federal government, which will reduce greenhouse gas emissions. And we're giving Ontarians greater access to clean, affordable, low-carbon energy. Just last week, the Minister of Environment was the first, it made Ontario the first province to require fuel suppliers to increase the amount of renewable content in gasoline by 15%. And we introduced a discussion paper to talk about the hydrogen economy, both protecting the environment and the economy. And in addition to that, we provided in our last budget $3.7 billion in green bonds to help finance public transit initiatives, extreme weather resiliency infrastructure, and energy efficiency and conservation projects. And Ontario remains the largest issuer of Canadian dollar green bonds in all of Canada. We also announced Ontario's Job Creation and Investment Initiative, which will make investments in clean energy generation and energy conservation equipment more attractive. We announced a $1 million pilot project for the Municipal Disasters Recovery Assistance Program to provide financial relief to communities. In addition, Speaker, we're making headway when it comes to our Canada-Ontario agreement, when it comes to Ontario waterways, as well as our continued work for the Lake Erie Action Plan to reduce phosphorus loading. And what's more is we also put a moratorium on water taking permits. We're also reducing the amount of waste in our landfill, and we're making progress soon to come on organic waste, which ends up in the landfill, causing methane gas, which is 25 times more potent than greenhouse gas emissions. Thanks to our policies, we will be reducing that waste from our landfills. Speaker, the member says there's no time to waste and the time to act is now, and we are acting. We will continue to deliver on our Made in Ontario Environment Plan. So while we're taking action and making accomplishments on protecting the environment, the NDP did not have an environment plan, and they waited 198 days, or 6 months and 17 days, after our government introduced our Made in Ontario Environment Plan to introduce their Green New Democratic Deal, which doesn't even mention Conservation Authority. The member opposite waited 698 days, or 1 year, 10 months, and 28 days after our government introduced our Made in Ontario Environment Plan. So yes, Speaker, there is no time to waste, and we're not wasting time. I will not be supporting this bill, as we've already done many of these things, and we have more to come. So stay tuned, Ms. Speaker. We're on it. Thank you.
Further debate? The member for Orleans.
Thank you, Madam Speaker. I'd like to begin by thanking the members from Parkdale High Park and Toronto Danforth for bringing forward this comprehensive bill. The measures outlined in the bill are thoughtful, prudent, and forward-looking, Madam Speaker. I think we can all agree that climate change is the most important and wide-reaching challenge of our generation and for all generations to come. And COVID-19 has revealed many challenges in our society. However, it's also highlighted the importance of investing in public health infrastructure, and it's highlighted the impact of the government cuts to public health in the first years of their mandate, Madam Speaker. We can all agree that it's important, fundamentally important for us to understand the public health impacts that we are going to face as a society as a result of climate change. And this bill would complement the overall provincial strategy to tackle climate change if there actually was one. The Auditor General came out last week confirming what we already knew, that the government doesn't have a plan to protect the environment. Not only are they starving the ministry, Madam Speaker, under the cover of COVID-19, the government has virtually eliminated transparency and oversight. And further, in the budget bill, the government's moved to reduce the fundamental role of conservation authorities, weakening environmental protections and local authority. Simply put, Madam Speaker, the Ford government is bad for the environment. It's been that way since they came in and tore up the cap-and-trade system. And as the Auditor General confirmed last week, they simply have no plan to achieve the results they've told us that they will. So once again, Madam Speaker, I want to thank the member for Parkdale High Park and for Toronto Danforth. And I particularly like the idea of having a select committee on this issue. Hopefully it's more robust than the recent select committees.
Thank you. Further debate? Further debate? Further debate? Back to the member for Toronto Danforth for his 2-minute wrap-up.
Thank you, Speaker. Speaker, my thanks to the members from Davenport, University of Rosedale, Richmond Hill, Mississauga East, Cooksville, Guelph, Barrie Innisfil, and Nickel Belt. Very chatty bunch. Speaker, it's unfortunate I only have about a minute and a half. There are a few things here. First, the member from Mississauga East, Cooksville, and the member from Barrie Innisfil effectively say that we've got everything in place to deal with the health threats today. Well, if that's the case, why weren't we prepared for COVID? Why weren't we prepared for the second round of COVID? Are we prepared for the emergence of dengue and malaria in Ontario? Because we've seen transmission of tropical diseases now in the northern United States. We'll be seeing it here as it gets hotter. Are our public health units ready for that? I don't believe that they are. I don't believe, frankly, that we're in a position now to take on Lyme disease. Talk to many of the rural members who have that issue. Member from Algoma, Manitoulin has been a champion on that issue. We're not even in a place to take care of that one. Set aside the vulnerabilities of the healthcare system as we see more floods and fires. How are we going to deal with more trauma? How are we going to provide healthcare services to more and more displaced populations? The suburbs of Sydney, Australia, last year were threatened by climate fires. We haven't seen that in major cities in Canada yet, but we will. And we have to have a healthcare system ready for that. The member for Richmond Hill said this is a very broad-reaching bill. He's right, and I'm glad he read it and thought about it. But I have to say, the Premiers Mike Harris and Ernie Eves were willing to shut down coal. And let me tell you, that was a big deal. It's something that people have been dining out on for a long time. If you're going to actually take on this crisis, you have to actually even reflect the ideas that were current with those governments over 20 years ago. Thank you, Speaker.
The time provided for private members' public business has expired. Mr. Tabuns has moved second reading of Bill 224, enact Climate Crisis Health Action Plan Act 2020, the Ontario Climate Crisis Strategy for the Public Sector Act 2020, and the Select Committee on the Climate Crisis Act 2020. Is it the pleasure of the House that the motion carry? Carry. I heard a no. All those in favour of the motion will please say aye. Aye. All those opposed to the motion will please say nay. Nay. In my opinion, the nays have it. Pursuant to Standing Order 101D, the recorded division on this item of private members' public business will be deferred to the preceding deferred votes.